the outside dividing line between the two ventricles. So you can see the left ventricle makes up a lot more than the right ventricle. Okay? Same on this one. If he has a cut heart out on the table, you just look for this big, thick dividing line. Okay? I'm trying to think what else. We'll do the tissues. Okay. So if we're looking at, this is one of the atria back here. This is the right atria. You see how smooth this muscle is? Yep. That's pectinate muscle. That's only in the atria. Okay. Once we get into the ventricle, you have the chordae tendineae, which attach from the valve to what's called papillary muscles. The papillary, they're kind of like fingers. They're like little finger-like projections. Oh, these are good ones over here. So little finger-like projections that are going to pull on the chordae tendineae. So that's what opens and closes the valve, is these papillary muscles pulsating and tugging on the strings. Okay. Once you get past the papillary muscles, you have trabeculae carnae down here. So you have two different types of tissue that you need to remember in here. The papillary is where all the chordae tendineae attach, and the trabeculae carnae is everything else down here. This thick muscle tissue that you have, myocardium, that's right. So the left side is a lot thicker than the right side, because the right side, like I said before, is only going to the lungs, and this is going to the whole body. That's right. All right, let's see.
What about the inside, the septum?
Oh,
The eyeball.
Oh, and the eyeball too, yeah.
so this is the interventricular septum.
It divides the right and the left. Right?
Yep, yeah, it's dividing the two ventricles. Okay.
Yeah, the eyeball deal. I couldn't find it.
So the fossa ovalis, is that what you're talking about?
Yep.
So you find the coronary sinus, and you're going to kind of pull that apart. Let me see if I can even find it on here. Okay, this one has a decent one. Okay, so you see that hole? Well, it's not a hole, it's like that white tissue. That's the fossa ovalis. Okay.
It's between the right and left atria.
Yes.
Atria. Okay.
So if you have a baby where this doesn't form correctly, you have the right ventricle or the right atria, which is getting deoxygenated blood, and the left atria, which has oxygenated blood. They're connected, so nothing's getting done. Okay, because they're connected, all the blood's mixing together. It defeats the purpose. And then we have, if we go into the aorta, remember this is the aorta. So if you go into the aorta, you have, you find it in here. You have coronary arteries. Okay, so the coronary arteries, you see it? They're going to supply the heart with oxygenated blood. So the heart, just like any muscle, it needs oxygen in order to function. So the coronary arteries are bringing blood from the aorta back into the heart. Okay, so this way it can get to all this muscle tissue to help it keep pumping. Okay? I think this might be the last thing. So you find the pulmonary trunk, and you find the aorta. In between the two, this one's broken, you have the ligamentum arteriosum. All right, that kind of holds the two together, and that's formed, I think, a 3-month-old. Yeah, 3-month-old, still in the belly. That's when that forms. Okay, and that kind of just holds everything together. That one's broken. That one's just non-existent. This one has it. Alright, so pulmonary trunk. This is the aorta. This one has a big one, even though it's short. Ligamentum arteriosum.
So it connects the aorta with the
Pulmonary trunk.
pulmonary trunk.
Okay. I think that's it. Do you see anything on there that I didn't cover?
Thank you.
No problem. Okay.